joining us. It has been a tough year or year and a half. And I think Dr. Nene, you have actually had your work across both India and US. Would love to start with understanding your experience. How do you see the pandemic response in both the countries, and they would take on that?
I think it's a great question. Before I begin, let me just say that in this pandemic, the doctors, the nurses, the frontline workers were the real heroes, because come, rain or shine, they were always there for their patients, working tirelessly. And honestly, when you go to med school, when you do all this stuff, you're doing it to help people. But never have I seen such a response. And even in times when we didn't have the means. So let's back up a step. This pandemic started probably in December of 2019. And when we first recognized it in February, with the Sentinel cases and the other things in India, but also in the US being reported, and by March then going into full swing, things became very, very bad, particularly in the Western world. And in the US, as we were following the news and talking to our colleagues, what we were finding is that we had a completely novel disease, which we knew little about. I mean, look, we've had SARS, MERS, 100 years ago, worldwide, we had a pandemic which cleared out potentially 25% of the population in certain countries. So this is not a new phenomenon, nor are vaccinations, nor are antibiotics and others. But this particular disease was interesting in a bad way, in that we didn't know the mode of transmission. We could not track every last detail. And we also didn't know what organ systems it would affect and how to deal with them. And so in the US, the initial issues they were facing was lack of ventilator beds, lack of trained physicians, lack of hospitals. And they quickly reached to the point in many locations, for instance, New York, where they were seeing massive casualties and death, both in the populations themselves, as well as the healthcare infrastructure. And the worrisome thing was that it was difficult to marshal all of the simple needs, let alone the complex ones. Forget about ventilators, oxygen, all that, which we faced much later. But in the US, the bigger issue was just simple things like PPEs, masks, all of these things, which you and I would have thought would be fundamental. They just weren't there. And so everything started to ramp up. I mean, all of the issues started to come to bear. And I would say in the US, unfortunately, the politics of things like masks and other things really got in the way, because where they needed to be united, they were kind of falling apart and questioning or doubting. The other thing is some of the key organizations like the CDC and the NIH and the WHO were being doubted. I would counterpose that to India, where interestingly, the government as a whole, as well, both federal and state, worked together to quickly put into effect a very strong response with a lockdown. Now, you can question the financial issues with that, whatever you want, but I would say in doing that, we cut the mortality significantly at that point. And then moving forward, the US, after some time, was able to figure out how to treat this. For instance, one key measure was that you don't need to aggressively ventilate everyone. You just need high flow oxygen. You can do prone ventilation. The second thing was what medications work. Initially, there were a lot of issues. And one key detail, and one which kind of inspired us to do what we did with communication and content and other things, was that things were going from preprint servers straight to the headlines. And in my estimation, this sort of created huge amounts of panic and huge amounts of concern in the public. And I tell you, I was just in New York, and people were saying, am I going to be next? How do I avoid this? What do I do? And people were stocking up their shelves with all kinds of things for doomsday. This was like something out of a movie almost. And New York just opened because they've had 70% of their population, at least with one vaccine. Now, I don't know personally if that's the right approach, because honestly, I think that still leaves a large amount of the population vulnerable, and particularly with these variants, which we'll talk about later, I think there's still an issue. Now, fast forward, India, for whatever reason, didn't face the mortality initially that the rest of the world did. I mean, in the US now, it stands at about 600,000. If you look at Great Britain, UK, you look at Europe, all of these guys early had very high mortality. We did not. Come about January in India, I think our numbers had gotten so low. To some degree, I think we were lulled into a false security. And, many statements were made that the war is done, we're there. And I think there was some writing on the wall, but honestly, I mean, there were three things in my book which were going on. One was the fact that we'd been in a pandemic for so long, people had pandemic related fatigue, and they really wanted to get out. They really wanted to get back to their lives. The second is that with the low rates and everything, we thought we could do more than we should have been. And then the third thing, which was critical, is that there were some variants which came in particular what we call the Delta variant now, which had a 60% higher transmission rate. And this in Jan, Feb, and then out to March resulted in massive increases in cases. And honestly, I mean, we did the best we could in ramping up supplies. It started in Mumbai, then Delhi, then kind of like a wildfire took over all over India, leading to pretty dense quote unquote lockdowns, because this time around they didn't do a complete lockdown. But for the most part, in Mumbai in particular, I think they did a phenomenal job on the local level to marshal war rooms and really come out and talk about what needed to be done. They had a very, very strict system in place for removing or minimizing transport. And they really, really tried to increase it. And I'll be very honest with you, we faced some of the same issues everyone else did, that it wasn't just ventilator beds. I mean, for a population of 24.5 million people, it was simple things like oxygen. But even going beyond that, it was a lack of experts. I mean, India is 30% metro, 70% rural. And when you look at the actual beds in the US, you have, in some cases, one bed to 350 patients. And when you look at ICUs, slightly higher. In India, can be one bed to 3,000 or 4,000 patients, depending on where you go. Now, if you're in South Bombay or something, it'll be much better. It'll look like something out of the US. But even there, we didn't have supplies of oxygen. We didn't have trained doctors and whatnot. And we just didn't have the beds. And so I can tell you in March, the struggle for us, as well as across India, was finding beds for patients. The second thing was who to admit. I did a piece on the admission criteria, because everyone who thought they had COVID panicked. And they said, I got to be admitted, otherwise I'm going to die, right? And so we quickly developed means to figure out who needs to be admitted, who can be left outside, and how to manage things. And then the third thing that happened was, as we started to do some of the other adjuvant measures like high dose steroids and whatnot, in some ways you started to get things like Mucor and things like that. So how do you stop that? And so a lot of healthcare related issues. I think there's a big silver lining, which we're going to talk about, and I'm excited about this, that certain systems started to ignite. And I think that doctors as a whole, the frontline medical workers as a whole, kind of came together very, very densely, trying to help each other out. I know my interactions with doctors across the country, across the world, were phenomenal. I mean, we finally felt like we were one. There was no issue that I'm from here, you're from there. And I think that's it, right? We're one people around the world. Whatever happens to us is reflected elsewhere. And particularly in the pandemic, that became very clear that you can have variants from different places, which can ignite increasing forest fires. So, all in all, I think things are kind of coming down now. I don't think we're out of the woods, because I think the next issue that you and I are going to face is going to be the vaccination of all our first critically at-risk population. And then I would say 18 and above, and then eventually the kids. And I think the government's made a smart decision in trying to create a public-private partnership. And use the means, because I mean, let's face it, we have a country where we spend 4% of our GDP on healthcare, of which 2/3 of that is private. In the US, you spend 16% of the GDP on healthcare. I would say the death count in India of 330 or 340,000 is a fraction of what actually happened. And that's the same everywhere on the planet, because a lot of deaths weren't recorded. But that being said, I think people have done a good job overall. There have been some things I think we probably should have avoided, some of the public gatherings and some of the other issues in February, March. But again, I think we were lulled into a false sense of security. I think we could have handled a few things better, but I think overall there were some shining moments in this. And I think one of those is my salute to all the frontline healthcare workers, our fraternity, as well as everyone else, the doctors in particular, who put their lives on the line for all of us. And so my hat's off to all of you guys, because you're the heroes in this one.
Indeed, very well said, and I could not agree more. I think the role the medical warriors have played is just commendable. And Dr. Nene, you started actually talking about the silver lining. I think one silver lining, which at least I see coming in this part of the world, is digital health. And as you rightly said, especially a country like India is so far behind in the infrastructure needs. Is digital health something which can really allow us to really leapfrog and really provide care and access to everyone at affordable rates? And I've seen this happening across not only India, but in US, in emerging markets as well. What's your take on it? Is it here to stay, or is it just a response to pandemic?
Chirag, I think it's a great question you're asking. There's a couple of points to make. First is sheer numbers in India, and then we'll talk about the US. In India, look, we've got 1.35 billion patients to take care of. And we have a million allopathic docs, another 600 to 800,000 Ayush docs. Of those, India is 2 Indias. And actually, when you look at it, it's 29 states, 7 union territories, and 30% of the population is in the metro areas, 70% is in the rural areas. Of that, 2% of the allopathic docs make it out to the rural areas. So you have a very dramatic disparity in care. As I envision it, everyone should have access to evidence-based international standards. And the only way we can do that is by scaling our infrastructure. But I mean, let's face it, you can't make enough med schools. You cannot make enough hospitals. You cannot build roads, electricity, running water fast enough. We'll get there. I assure you, by 2050, I think India will be one of the premier economies in the top 3, just by volume and by hushari, as I call it, not jugaad, hushari, right? And my feeling is this: telemedicine gives us that edge. I mean, one thing is clear in India is that sometimes we get the technology later than the Western world. And so as a result of that, you see a leapfrog of things. This happened with 3G, 4G, whatnot.
Indeed.
And so what I see with telemedicine is the ability to take care of far more patients in a meticulous fashion. Now, the real issue until the pandemic was adoption. And we're not just talking about India, but we're talking about the US too. In the US, 350 million patients, there is still 10 to 15% of the population that's underserved. But I would go one step further, that even the most wealthiest patients don't always get the best care because they don't have access. So what it comes down to is 2 things. The gap is a lack of awareness of what's good for each patient, which allows them to take care of themselves. And the second is a lack of access to world-class evidence-based medicine through infrastructure players. Now, I think the awareness alone can triage who needs to be seen and when they need to be seen. And then that will lead to a phenomenon where we can access the facilities and triage people who actually need to come in. And when you do that, look, in India, the life expectancy is 10 years less than the rest of the planet. And obviously in COVID and all that, the life expectancies in the West went down at a far higher rate than India, but that's what we know about. We don't know the total number of deaths. And that's one interesting point to bring out, that India doesn't have one consolidated infrastructure for healthcare like they do for banking and other stuff. We're working on something which we'll hand off. But the idea is that you don't know what the actual mortality is and what the all-cause mortality is because it's often not reported in one place. And that's not the case elsewhere on the planet. You can't change something or make it better without having those numbers because you don't know where to turn your attention. But I think telemedicine will allow us to do that. The second thing it'll allow us to do is to scale the doctor's reach. As a heart surgeon, my biggest issue when I was practicing for 20 years is I could operate on 300 to 500 patients a year. I mean, how many open hearts, valves, aortic cases, EVRs or deployments can you do as a single surgeon? Using a combination of media technology and smart services with what we're doing now, I imagine that we can take care of hundreds of millions to billions of patients together, right? And I think that change is beginning now. So the silver lining, in my estimation, is that people have recognized the power of telemedicine. Now, I won't lie to you in saying that it's not good for everything. In things where you actually need a physical exam, where you actually need to see your patient, obviously you need to see your patient. But I would say it's if you can even give the patient the ability to recognize and take care of themselves, and number two, the ability to reach out when they need a higher level of care, that is half the battle. Because otherwise in India, it's always a natural history study. It's something you read out of a book in medicine where they come in very late in the disease. And as a result of that, we see complications and we see a outcome which is subpar. And I think the only way to change that is by swinging the pendulum from acute care to prevention, early recognition, and early treatment. Doesn't mean the number of cases will go down, it'll actually go up, but they'll just be treated at an earlier state. And I think telemedicine will help us do that.
Indeed, indeed. But I've always, at least we always discussed the key challenges in India. And I think they always talk of 3 A's, right? Which is access, affordability, and awareness. I personally believe that 2 other A's, which actually have been a bit of a roadblock. I think one is just apathy towards healthcare, staying healthy, and acceptability towards getting treatment early. And I think in last 400 days, healthcare has been on front page of every newspaper in India. Has never happened again. So it's caught up everyone's imagination. So just maybe the last question, crystal ball gazing, 5 years, 10 years, 20, 30 from now, what do you think the healthcare system is going to evolve? I think given people had a really, really painful time. Any thoughts on that?
It's a great question. I think your point about affordability is a big one with the 3 A's, and we didn't really talk about that, but I think there are ways to do this, and it has to be a public-private partnership. I mean, look, India has 4% of the populace paying real taxes, and then the rest is GST. In a pandemic situation, you have no money to fuel this machine. And 2/3 of that 4% GDP is private. So that's one point. But looking forward, right? I think if you can marshal every single aspect of a public-private partnership, getting the best players, and building a universe of superheroes, as I call it, who can lead the way, we will change what's happening. Coupled with that, I think there's some key changes which will occur, both on a scientific level. For instance, we saw in this pandemic, they have never been able to create a vaccine in less than a year. And with the advent of CRISPR, with the advent of some of the technologies which came in after 2012, actually, and for some, which have received Nobel awards, things like that, the science of this has changed dramatically, you guys. And so what I see is we'll be able to better predict who's at risk. Because if we can do that and we can identify our target population much more specifically and create personalized precision healthcare, all of a sudden you have already sifted through the people you don't need to worry about and who certainly need medical care. One other point you made, which is very interesting, is that healthcare solutions for wellness are often not adopted by everyone. I mean, look, let's call it what it is. In India, people just are trying to survive sometimes. They don't have time until they get sick to go to the doctor. So I think what we need to be in is awareness mode where we build dense preventative networks, even simple things like vaccinations, and yearly checkups and things like that. If we can do them, we're going to be able to triage the people who most need healthcare earlier and prevent things. I mean, India is a capital for diabetes. It's a capital for heart disease. And these, in many cases, are, if not preventable, reversible, right? And we're working towards that. Secondly, I think we need much more attention driven to how we deploy our forces and look at outcomes research, right? I think that we need to be reporting this stuff. I think we need to look at how things happen and get best practices in place always, that there should be pathways. Pathway-driven medicine is there in the best hospitals, but I don't think it's there across everything. And I think it'll help doctors because doctors are overwhelmed. I mean, typically, the turnover is so high in patients that you don't have the time to explain to patients what's going on. And so that was one thing we had done. There's three aspects of what we're targeting. One is media to raise awareness and entertain and educate, at the same time as a very dense technology platform, which provides both continuity of care, AI to help diagnostic decisions and care decisions, as well as dense data research to figure out what outcomes should be, and also dealing with that, with everything that happens with a patient from the cradle to the grave. And then finally, the smart services marketplace, where you deploy the services you need when you need them and not before that. Because I think that a lot of people don't know. They honestly don't know what to do. And I think the pandemic's made that ultra clear that there's some opportunities here. So in the next 30 to 50 years, I see huge changes in the science of medicine, to some degree, the practice of medicine, because as a planet, we don't have enough doctors. And to be honest with you, I think it has to be a multidisciplinary affair. It's not just doctors, it's nurses, it's other practitioners, it's ayas, other caregivers who can take the battle to the front lines and really engage the patients. Because if you rely on just doctors, we're never going to achieve that. We don't have the mass. I mean, 1 million allopathic docs talking to 1.35 billion patients is not adequate, right? And we can't generate doctors. We don't have enough med schools, first off. And secondly, the doctor density in the regions where we need them are not there. So we'll have to think differently. We'll have to create multidisciplinary approaches. We'll have to use telemedicine to greatly scale it. Now, I think some of the things which are already there in the Western world will come here in the way of digital health, creating quantified self, not necessarily owned by a specific patient, but potentially owned by the Gram Panchayat or something in a village, where you quantify how each patient's doing on a regular basis. I would say corporates can play a ready hand in that. Certainly insurers and governments can, but there's other players who can intervene and see to it. And with all the data you connect, if you anonymize that data and practice good hygiene in terms of privacy and all, we can predict what are the best practices. We will evolve the practice of medicine in India for the global audience because our numbers are so high. And it doesn't mean that we become guinea pigs, quite the opposite. What we'll end up seeing is what is the best medicine for diabetes? What are the best practices in terms of eating, in terms of activity, in terms of all that? Because we'll collect all that data and we'll see it. So I think we're only at the start of this. The last piece, which I didn't talk about, was communications. And I think that we as doctors have to really be part of the process. I think we're too busy on the front lines. In practice, I can tell you, I didn't have the amount of time. I mean, I would joke about it that, you listen to the patient for a half an hour to 45 minutes. In India, it's even less than that sometimes. And then you write them a chitti and you send them on their way. And you don't always have the time to really engage them and teach them. And without that, I don't think we'll end up preventing the next occurrence because they don't understand the disease. So, all of that communications. The second thing is, what should they really worry about? What are the cardinal signs and symptoms? What is the treatment? I know through this pandemic, you and I and everyone else have been faced with struggles like Mucor, this, that, the other. But listen, sensationalism aside, what is the actual data? How risky is it to do this treatment versus that treatment? I think if we can talk with scientific basis and we can have high integrity and base it on, huge peer-reviewed studies. And I would say this last year has been kind of a study in the lack of that, mainly because we were moving so fast with this disease, we didn't really know. But the truth is, there were multiple issues, HCQ, this, that, the other, and there still are to some degree. And that should never happen, right? I think what we should do is sit down together, join hands, and say, what is the burden of evidence? And is it class 1, 2, or 3? Is it A, B, or C? And then speak as a group. And I'm not just talking doctors, I'm thinking all facets of society so that we don't panic people, right?
Yeah. No, I think very, very articulate. I think very nicely said as well. I think we have to find a way to create more leverage for doctors, create a multidisciplinary approach, rope in corporates, community to really to the disease management, and also move away from purely treatment to more prevention and more healthy living. That was indeed a fantastic conversation, Dr. Nene. I think the topic is very interesting. We can go on for hours and hours, but thank you so much for sharing your thoughts and look forward to staying in touch. Thank you.
Absolutely, Chirag. Thank you so much for the opportunity. And I wanted to thank you and Josna and her whole team, Viraj and Real, for organizing this, because I think it needs to be done. I think that we're at a time where you got to celebrate the small victories as well as identify whatever obstacles are in our way. And having these types of dialogues is how we do that.
Indeed. Thank you.
Okay, you're welcome.
Thank you so very much, Dr. Chirag Adatia, Dr. Nene. It's been a pleasure listening to both of you have this candid conversation. And like Dr. Nene mentioned, it's really about celebrating the small victories and looking forward to healthy living. And that's exactly how we'd like to celebrate this day. Moving forward, we'd now like to pay a tribute to our healthcare warriors. Let's bring to you a reel of few of our healthcare warriors in association with AHPI. So looking forward to all those fantastic bites from our ambulance drivers to our ASHA workers, our nurses. It's a salute to each one of you. Here we go.